Established in July 1998, the New Zealand Blood Service exists to supply safe, quality blood and blood products to New Zealand patients. This responsibility covers all aspects of the transfusion process, from the collection of blood from volunteer donors, processing, testing and issuing to patients within the hospital environment. Divided into 4 geographic areas, these are supported by a national office in Auckland. Major collection hubs can be found in Auckland, Hamilton, Wellington and Christchurch, with smaller centres in Dunedin, Nelson, Palmerston North, Napier and Tauranga. Regular mobile collection runs are also made to many towns and regions across New Zealand. Blood donation testing is undertaken in Auckland and Christchurch, where state-of-the-art equipment and systems are maintained. The processing of blood into its initial core components is undertaken at the 4 hub sites. Some specialised products are fractionated in Australia before being returned to New Zealand. The New Zealand Blood Service operates its own blood banks in the 6 major District Health Board hospitals. Blood bank work in the smaller DHB hospitals is carried out by the hospital laboratory staff. The NZBS Board of Directors have a direct reporting line to the Ministry of Health. The Chief Executive Officer communicates with the executive team and senior managers, who in turn communicate with team leaders and NZBS staff.
Communication starts with our marketing and connecting with the donors, from calling them up to invite them in, to actually making it a really pleasant experience for them. They're coming in here to give of themselves, so it's important that we provide them with an environment that is really friendly. A huge amount of the communication links with the district health boards as they put their calls in for product, and then our blood banks fulfil the orders that they place. Training is a really fundamental part of what we do as an organisation to ensure that we achieve that overarching goal we have, where safety is our cornerstone and we're always striving for excellence.
Over 500 staff are engaged in donor and technical services, clinical, marketing, recruitment, information systems, quality, human resources, logistics, administrative and finance functions. Over 60% of the workforce are qualified professionals in the areas of nursing or medical laboratory science. An integrated annual plan provides the backbone for the collection of 140,000 whole blood donations per year. Additionally, 61,000 litres of plasma and over 17,000 adult doses of platelets are required. The National Marketing Department provide direction and support to achieve these goals through diverse and enthusiastic campaigns. Apart from the core activities of collecting, processing, testing and issuing blood, the New Zealand Blood Service provides several specialised services. The reference laboratory team are tasked with investigating unusual and often complicated blood groups and antibodies in patients. Blood donors are also eligible to join the New Zealand Bone Marrow Registry.
We're the only organisation in New Zealand that's responsible for tissue typing patients and organ donors to improve the overall safety of kidney, liver and heart transplants. We also are closely involved in the provision of bone marrow transplant services, responsible for collecting the stem cells and freezing the stem cells from patients so that they can be available should they need them later on in the course of their treatment. We're now the main provider of stored bone for use in orthopaedic surgeries. We're the only supplier of skin, which is widely used by the National Burns Unit at Middlemore Hospital.
Transfusion medicine specialists, supported by medical officers, play a key role in ensuring that the broad clinical role within the New Zealand Blood Service is achieved. This covers both the selection of donors and provision of advice and support for the management of patients with complex clinical problems. Transfusion nurse specialists provide the on-site medical interface between the blood service and the district health boards. They also take responsibility for transfusion-related education and training within the major hospitals. Regulatory compliance is underpinned by a comprehensive quality program. MedSafe, the regulatory arm of the Ministry of Health, together with International Accreditation New Zealand, endorse their approval through annual audits. Internationally accredited computer systems provide a solid framework for the management of donors, blood collection, processing and testing systems, and financial control. Over 40,000 patients benefit each year from the Blood Service's commitment to supply safe, quality blood and blood products to patients in New Zealand. This would not be possible without the support of over 120,000 voluntary blood donors throughout the country.
And New Zealand Blood Service is recognised internationally as having one of the safest blood services in the world.
It's one of the great strengths of this organisation is the passion of our people who know that every day we come into work and we're actually helping the community and helping to save lives.